988 Crisis Hotline is losing its LGBTQ youth program, according to the Department of Health and Human Services.
The bill for the Crisis Hotline gained bipartisan support during the Trump administration back in 2021. WHS 11's Alex Dieterer today has been talking to local psychologists. Alex, what are they telling you would be the biggest impact for LGBTQ youth?
So, Doug, Connie, the 988 Crisis Hotline has not existed without this specialized program since it was enacted. And according to the Department of Health and Human Services, the LGBTQ youth program has served nearly 1.3 million people since it started in September of 2022. Local psychologists say the loss of these specialized programs could also mean the loss of life. The Trump administration is eliminating the 988 Crisis Hotline LGBTQ youth program, according to the Substance Abuse and Mental Health Services Administration. Fairness Campaign Executive Director Chris Hartman calling the move harmful.
This has got to be the single most helpful tool that LGBTQ youth have used over the past several years, saved countless lives.
When the bill for 988 was passed unanimously during the first Trump administration, Congress agreed that they wanted to target particularly vulnerable groups of people who need mental health services. The two they found were veterans and LGBTQ youth.
We want to keep funding for veterans. We also need funding to prevent LGBTQ youth suicide.
The $520 million budget for the Crisis Hotline is staying the same, but the money is being reallocated to, quote, focus on serving all help seekers, according to the Department of Health and Human Services. National reports say the Trump administration is eliminating using taxpayer money to, quote, embrace radical gender ideology by counselors.
I am not going to sugarcoat this. We are going to lose lives as a result.
Tanner Mobley is with the Trevor Project, a nonprofit focused on suicide prevention for LGBTQ youth. He says they could expect 230,000 additional contacts reaching out every year because of the eliminated 988 services, something they're not equipped for.
This is about protecting the lives of young people.
The Substance Abuse and Mental Health Services Administration says everyone who contacts 988, quote, will continue to receive access to skilled, caring, culturally competent crisis counselors who can help with suicidal, substance misuse, or mental health crises, or any other kind of emotional distress. People calling for the LGBTQ youth program will still receive help, but no longer have access to specialized counselors.
You need somebody who understands what it's like to face family rejection, bullying, harassment, violence, due to the way they're treated in society.
Dr. Eric Russ with the Kentucky Psychological Association and Dr. Sheila Schuster with the Kentucky Mental Health Coalition both say they see a higher risk for suicide attempts among LGBTQ youth.
The best practice in suicide prevention is to target your intervention or your feedback to the population that you're serving.
The Trevor Project assures that even with changes at the federal level, resources will still be available.
We've been here for 25 years and we plan to be here for 25 more.
The change to the LGBTQ youth program is set to be eliminated July 17th. And even with these changes, psychologist Sheila Schuster is still urging people to call or text the hotline if you're in urgent need. The hotline is available 24/7. You can just call or text 988. And the number for the Trevor Project is 1-866-488-7386.
Thank you so much, Alex. And this group of young people does have a greater risk of mental health issues, according to the Trevor Project, which surveyed over 18,000 LGBTQ plus members from the age of 13 to 24. 12% had attempted suicide within the last year. 50% reported they were unable to get the mental health care they needed, and 49% of kids aged 13 to 17 reported that they were bullied.